What's on your radar, Batya?
Something we cover on here a lot is the giant faceplant the scientific community has done over the course of the pandemic. We all know now about the epic flip-flops of those who anointed themselves representatives of the science, TM, how they pushed lockdowns, then the vaccines, then vaccine mandates, legislating their own preferences regardless of the consent of the governed. From the safety of their own homes, which skyrocketed in value, leftist elites in medical, political, journalistic, and policy fields imposed what worked for them. Indeed, what made them even richer on the millions of working class Americans whose labor they relied on to survive. 1 in 5 small businesses closed down, while Fortune 500 companies saw record sales. Private school children soared astronomically ahead of their public school counterparts, who were relegated to Zoom learning by the laptop classes regime, even those with no access to a computer. The pandemic was not just responsible for the deaths of millions of Americans, it turns out. It was also the largest transfer of wealth from the middle and working classes to the credentialed elite and billionaire classes, who cast anyone who opposed lockdowns as moral perverts while they watched their own bank accounts swell. Then, when it came time to end the lockdowns, they demanded that you take the vaccine to protect them while you served them so they could feel comfortable being waited on by you in restaurants and hospitals. From the start, the pandemic pitted the interests of middle and working class Americans against those of the elites. A largely white-collar knowledge industry email cast was easily able to start working from home, but rather than recognize the economic privilege of getting to stay home making banana bread and buying Peloton bikes, the pajama class dressed this privilege up as virtue, which correlated strongly with the lingering terror around getting COVID. It was a terror that working class Americans, Amazon delivery drivers, grocery store stockers, truckers, police officers simply could not afford. They had to continue to work throughout the worst of the pandemic, delivering food and safety to members of the liberal elite ensconced in their homes, denouncing anyone who opposed the draconian lockdown measures of blue states as a grandma killer. In other words, while relying on the labor of the working class, an over-credentialed elite demanded that the gap between the unwashed, exposed masses and the safely protected rich grow even wider. They demanded endless lockdowns that didn't slow the spread of COVID, though they did grow the gap separating the elite's children from the Black and Hispanic kids whose schools were forced to close over and over by the teachers union. As lockdowns reduced millions of small business owners to poverty and swelled the stocks of big box megastore stocks, the elites brayed for more. Their boredom shopping sprees gave Amazon record profits, while middle class business owners, with their savings gone and their businesses dead, committed suicide. And throughout, liberal elites somehow convinced themselves that they were the good guys, the ones who cared about the collective, as opposed to those evil individualists who refused to see their life savings go up in smoke without complaint, or who were worried about what a brand new vaccine might do to their teenage sons. How did they allow themselves such blindness? A new Newsweek op-ed explains what this looked like from the inside. In a piece titled, "It's Time for the Scientific Community to Admit We Were Wrong About COVID and It Cost Lives," Kevin Bass, an MD PhD student at a medical school in Texas, explains how the scientific community got COVID so wrong and how it cost lives. Quote, "As a medical student and researcher, I staunchly supported the efforts of the public health authorities when it came to COVID. I believe that the authorities responded to the largest public health crisis of our lives with compassion, diligence, and scientific expertise. I was with them when they called for lockdowns, vaccines, and boosters. I was wrong," writes Kevin. "We in the scientific community were wrong, and it cost lives." Quote, "I can see now that the scientific community, from the CDC to the WHO to the FDA and their representatives, repeatedly overstated the evidence and misled the public about its own views and policies, including on natural versus artificial immunity, school closures and disease transmission, aerosol spread, mask mandates, and vaccine effectiveness and safety, especially among the young," writes Kevin. "All of these were scientific mistakes at the time, not in hindsight. Amazingly, some of these obfuscations continue to the present day." Kevin goes on, "What we did not properly appreciate is that preferences determine how scientific expertise is used, and that our preferences might be, indeed our preferences were, very different from many of the people that we serve. We created policy based on our preferences, then justified it using data. And then we portrayed those opposing our efforts as misguided, ignorant, selfish, and evil." Kevin goes on, we made science a team sport, and in so doing, we made it no longer science. It became us versus them, and they responded the only way anyone might expect them to, by resisting. Quote, we systematically minimized the downsides of the interventions we imposed without the input, consent, and recognition of those forced to live with them. In so doing, we violated the autonomy of those who would be most negatively impacted by our policies: the poor, the working class, small business owners, Blacks and Latinos, and children. These populations were overlooked because they were made invisible to us by their systematic exclusion from the dominant corporatized media machine that presumed omniscience. Joining us now to discuss his very brave op-ed is Kevin Bass. Welcome, Kevin.
Thank you, Batya.
So your piece really went viral, and I'm wondering if you could start by telling us a little bit about what made you write it and why you think it resonated so much.
When I was sitting here listening to your discussion of the piece and the discussion of the pandemic, I was just reminded, especially by how powerful the way that you put things, I was reminded about the emotional valence that I felt that originally drove me to write the piece. When I first started writing about this on social media, I was mostly in a state of basically regret and sadness about what I had participated in for the last several years. And listening to, once again, really brought me back to that place. And I just wanted to tell everybody and tell anybody who wanted to hear it that I was sorry, because I indeed am extremely sorry and saddened by the way that things went during the pandemic.
Why do you think that's such a rare position? I mean, I think one of the reasons the piece went so viral was because it's very rare to hear somebody say that, and yet it's such an obvious point. I think between the two of us, it seems such a clear and obvious point. Why do you think it's so rare?
I think after several years of defending the establishment policies, and especially I think within our social circles, within the medical community, scientific community, and public health communities, and as well in the media, I think we have just constantly reaffirmed and reinforced our beliefs amongst each other to such an extent that it's almost impossible for us to see otherwise. Amongst ourselves, we have demonized our opponents. Anybody who has a different point of view, we tend to think of them as broken or bad people, as having nefarious motives, as wanting to make money, and having such a negative opinion about anybody who criticizes our beliefs makes it impossible for us to see, if I decided to change my beliefs to become, say, for example, one of them, it makes it impossible for us to contemplate the possibility that we could do such a thing. We don't want to be one of those people, we want to be one of the good guys. And so this has created this dichotomy of good and bad guys. It's just almost impossible for us to see outside of that and then make that transition. It requires really deconstructing and taking apart those beliefs that we've had ingrained in us and that we've been ingraining in each other to allow us to be able to then switch our positions. And I think this is one of the main reasons why almost nobody seems to be able to do this. And then many people who are even reading my piece are so resistant to the things I'm saying. In fact, many of my friends think that that I've somehow lost it, and I don't, because now I'm on the other side, and now I'm, that's the only way I could possibly be on the other side, is if I've lost it for some reason. It's actually very sad.
Yeah, it speaks to the fact that dissent, like daring to disagree and to dissent, is now, with respect to the COVID debate, is a conservative or contrarian position, the media, for example, it treats you like you're crazy, you're spreading misinformation if you have questions, if you disagree. The establishment, Democrats, that whole team is now bought into the idea that, oh yeah, you uncritically listen to the experts in the relevant field and do whatever they tell you to, regardless of whether you think that's correct or whether you have questions or whether you think there are downstream consequences that are outside of their field of expert, like what would happen to the economy, what would happen to schools, that kind of thing. There's none that is the wrong approach from if you're part of the Team Blue tribe. It's so weird that it's gotten to be that way.
Yeah, it's unbelievable that we can't think for ourselves anymore. We can't question things. We can't criticize things, and we have to have one team or the other team, or you're either a good or a bad person. Democratic discourse and democratic civil discussion requires us to be able to consider other points of views. And if we can't consider other points of views, then we can no longer really have, then we can just dismiss large swaths of the population for their preferences and think that they're illegitimate. That's no longer a democracy.
Quite right, Kevin. Thank you again so much for this brave piece and for joining us today. It was so great talking to you.
Thank you, Batya. It was a pleasure.
More Rising right after this.